Hello, my name is Amir, and today I will talk about the vaccines that people should take. So, the first one is varicella, second is COVID-19, third is HIV, fourth is hepatitis A, and fifth is hepatitis B. So, I will start with varicella, which is chickenpox. Chickenpox is an infection caused by varicella zoster virus. It causes a rash with small fluid-filled blisters. What it causes? Bacterial infection of the skin, soft tissue, bones, joints, or blood. Sepsis. Uh, Dehydration, infectious pneumonia, brain inflammation, toxic shock syndrome, Ray's syndrome in children and adolescents taking aspirin during chickenpox. And also, people can die. So, who is at risks? Newborns, new children that just have been born, whose mothers have never had chickenpox or never have been vaccinated. Adults, also pregnant women who has never had chickenpox. Uh, if people smoke, they also can have this disease. People with weak immune systems also can have this varicella infection. Uh, and or if they uh, had treatments such as chemotherapy or diseases such as cancer or HIV, also can have chickenpox. And also people who take steroid medication for other diseases or conditions such as asthma can have this disease. So when to take it? Your child needs 2 doses of chickenpox vaccine. The first dose is given at 12 to 15 months of age, and the second at 4 to 6 years. Okay, COVID-19. COVID-19. So, what are the symptoms? According to the CDC, which is of the Center for Disease Control, I think. Recommendations: everyone 6 months of age and older needs the COVID-19 vaccine. The vaccine can prevent COVID-19. The vaccine can prevent COVID-19 in children. Uh, a rare but serious complication. COVID-19 symptoms are sometimes asymptomatic. The most common signs and symptoms include fever, cough, tiredness, and loss of taste or smell. Other signs and symptoms may include shortness of breath, muscle pain, chills, sore throat, headache, chest pain, diarrhea, vomiting, and nausea, uh, which is stomach pain. So, yeah. How to, oh, I already talked about this. How to avoid the infection. There are many steps you can take to reduce your risk of contracting COVID-19 or transmitting the virus to others. CDC, which is Center for Disease Control, recommend the following things. Um, get vaccinated. Second one is avoid close contact with anyone who is sick or showing symptoms, because it will be easy to get sick because of them. Also, you need to keep your distance from the others in indoor or public places. Um, Avoid large crowds and indoor places with poor ventilation, because if there will be no ventilation in the indoor places, the virus will stay in the room. So yeah. And one of the most important things is wash your hands frequently with soap and water for at least 20 seconds. Uh, if you have no opportunity to wash your hands, you need to at least use the sanitizer that has 60% of alcohol. Diphtheria, pertussis, tetanus vaccine. So, uh, diphtheria often causes inflammation of the throat and oral muscles. In addition, the toxin secreted by diphtheria bacteria can also cause heart, kidney, and nerve damage. Diphtheria is one of the leading causes of death among children. Uh, the vaccine comes in two dosage forms. Tetanus secretes toxins that can cause severe muscle cramps. The bacteria often enter the body through a wound. 3 is, oh, never mind. Whooping cough is a highly contagious respiratory infection that is especially dangerous for children under 2 years of age and those with weakened immunity. DT, uh, I will call this DTAP because it's hard to pronounce it every time. So, DTAP vaccine is administered by intramuscular injection, which means in muscles. As part of routine childhood vaccinations, DTaP is given in 5 doses, typically at 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years. DTaP is followed by a lifetime booster dose of TDAP at 11 to 12 years of age and given to persons 13 of age or older who have never received TDAP or are unsure whether they have. This dose is followed by a TD booster vaccination every 10 years. Pregnant women receive one dose of TDAP during each pregnancy, preferably preferably pre- preferably between 27 and 32 weeks gestation. After pregnancy, women who have never received TDAP will receive one dose. Certain conditions may affect whether and when people get vaccinated. If a patient has a temporary illness, doctors often wait until the illness subsides before administering the vaccine. Side effects. Pain, redness, and swelling will occur at the injection site. Serious side effects are rare. They include high fevers, intense crying, brain problems, convulsions, shock, and severe allergic reactions. Serious adverse reactions are often caused by pertussis vaccine. If this occurs, pertussis-containing vaccines are no longer used. Instead, TD vaccine, which does not contain pertussis, is used to complete the vaccination series. DTaP or TDAP vaccines will not be reused if convulsions occur within 3 days of vaccination or other signs of brain failure occur within 7 days of vaccination. Haemophilus influenzae B infection, which is HAB. What is this? So, HAB is a bacterium that can cause serious invasive infections, particularly affecting young children. Contrary to its name, HAB does not cause influenza. Symptoms. Um, so the infection is in most common appears in young children under the age of 5, with the older children at relatively low risk. Invasive infections most commonly present with the symptoms of meningitis, and the introduction of bacteria into the blood is often concurrent. The infection can also affect several parts of the body, such as the lungs, epiglottis, which is the upper part of the throat, joints, and bones. Clinical symptoms depend on the part of the body affected. Meningitis can cause fever, headache, stiff neck, and symptoms such as loss of appetite, nausea, vomiting, photophobia, confusion, and drowsiness. Patients with epictesis may experience symptoms such as fever, sore throat, drooling, pain in swallowing, refusal to swallow, and even difficulty breathing. If the child has a fever, abnormal behavior, or worsening condition, or if there's doubt about the condition, seek medical attention immediately. Route of transmission. HIV infection can be transmitted through contact with throat secretions or patients. Prevention method. One is maintain a good personal hygiene. Always keep your hands clean, especially before touching your mouth, nose, or eyes. After touching public facilities such as handrails or doorknobs, or when the hands are contaminated with respiratory secretions, you always need to make sure your hands are clean. The second is wash your hands with liquid soap and water. Rub them together for at least 20 seconds. Uh, and then dry it with dry toilet paper or hand dryer. If hand washing facilities are not available or hands are not visibly stained, it is also effective to use a hand rub containing 70 to 80% alcohol to clean hands. So use a hand rub. Um, the third is cover your nose and mouth with tissue when sneezing or coughing. Dispose of used tissue in a covered bin. Clean your hands very carefully. Symptoms. The incubation period for hepatitis A is usually 14 to 28 days. Symptoms of hepatitis A vary in severity and may include fever, malaise, loss of appetite, diarrhea, nausea, abdorm, abdominal discomfort, dark urine, and jaundice, yellowing of the eyes and skin. Not everyone infected will show all the symptoms. Um, Hepatitis A is mainly transmitted through the facial oral route. Uninfected people ingest food or water that has been contaminated with feces from someone with the virus. At home, transmission can occur through dirty hands if an infected person prepares food for their family. Waterborne disease outbreaks are uncommon and are often linked to water contaminated or improperly treated with sewage. Casual contact between people does not spread the virus, but close contact with an infected person's body, such as sex, can cause infection. So who is at risk? People who have not been previously infected or who had not been vaccinated can become can be infected with hepatitis A virus. In areas with widespread virus transmission, high prevalence areas, most hepatitis A infections occur in early childhood. Risk factors are poor sanitation, lack of safe water, living in an infected person with an infected person, sexual partners of patients with acute hepatitis A, use of recreational drugs, male sex, travel to highly endemic areas without vaccination. Mm, yeah, so prevention, improved sanitation, food safety, and vaccinations are the most effective ways to combat the disease. Transmission of hepatitis A can be reduced by adequate supply of safe water, drinking water, proper treatment of sewage in the community, promote good personal hygiene, such as frequent hand washing before meals and after using the toilet. There are several inactivated hepatitis A vaccines available internationally. All the vaccines offered similar protection against the virus with similar side effects. There is no vaccine approved for children under 1 year of age. Thank you for watching.